Hello and welcome to Bristol Health Cares. I'm your host, Kurt Barwis. I am the president and CEO of Bristol Health. This program is for you. It's really about how you navigate the system of care, how you access care, and it's really about trying to answer questions you may have and really didn't know who to ask. We are going to bring to you professionals, doctors, surgeons, other healthcare professionals throughout our system of care, maybe people that you've never talked to before or met before, but the goal is to really help you understand how to access care when you need it. You're going to enjoy this program. This program is really for you. So what's important is if there is something that you want to learn about or know about or a guest that you'd like me to host on this show, write us and we'll try to make that happen for you. So enjoy the program, Bristol Health Cares. Hello and welcome to this episode of Bristol Health Cares. I am Kurt Barwis, your host, and with me today I have two fine gentlemen from the Bristol EMS ambulance service in Bristol, Connecticut, Enis, Myra, and Boblee, Bruce. Welcome, and we'll start off just by telling us a little about yourself.
Yeah, absolutely. Thank you for having us. So my name is Enis Myra. I'm the manager of professional standards for Bristol Health EMS. I've been with the organization for 11 years now. I started March of 2013, so it's been a little while.
Wow.
I did start as an EMT back then, and then kind of moved up the ladder. I became a paramedic shortly after. Then I was promoted to an operations supervisor. So I was that for a few years, and then recently, like a couple years ago, I did get a promotion to the manager of professional standards. So in EMS, it's kind of like weird because it's always a conversation about not having a clear ladder to move up, right? It's like, oh, you're an EMT, you're a paramedic, that's really it, right? But for me, I think I've kind of proven that wrong.
I was just going to say, it sounds like you had a clear ladder.
Yeah, absolutely. Yeah. So I think that you just kind of need to keep at it, like with dedication and passion for what you do, and kind of seize the opportunity, and you can move up.
So Enis, I think people are going to wonder, what does it mean, professional standards?
Yeah.
So talk just
absolutely.
what that is.
So what I'm in charge of is basically quality assurance, quality improvement program, right, for the EMS. I'm in charge of training, so onboarding new EMTs and paramedic and training them. I'm also like the field training officer coordinator, so when these new people come in, they have to do field training. So we have field training officers that do that, and I'm the coordinator for that training program. So also a little bit of billing, right? So a little bit of kind of like everything.
That's important.
Yes.
Keeps the gas in the trucks,
sure,
in the ambulances. So that's great. Boblee, tell us about yourself.
Hi everybody, I'm Boblee Bruce. I too started with the organization in January of 2017. Started as an EMT, worked as an EMT for a little bit, then got promoted to paramedic. Worked as a paramedic, climbed the ladder, moved to FTO, paramedic FTO, and I recently obtained a promotion of operations supervisor.
Operations supervisor. So another ladder.
Yeah.
A clear ladder. This is great.
So I mean, in my role, I kind of, our shift, we kind of see over the day-to-day operations, running the shift, making sure everything goes smoothly. Also involved in patient care as when we're needed. I work days and nights, so it's a little bit different dynamic when it comes to that point, but kind of do a little bit of everything, including some professional work, some patient care, billing, and just being part of the organization.
It's quite interesting when you see the ambulance, you got paramedics and EMTs, but you two just described a whole bunch of stuff that happens that I think people don't realize. And he really talked a lot about, in just a short time frame, about you're looking at quality, you're looking at outcomes, you've got supervision, you've got management. There's a heck of a lot that goes into making sure when you go to somebody's home or wherever to pick them up, you're prepared.
Yeah, absolutely. I think that, like the behind the scenes, it's always kind of like people don't really realize that it's like how much it goes to, like from the scheduling, making sure that, like all the ambulances are staffed so that we can respond, all the quality behind it, right? Like the reviews of the PCRs, making sure that, like patient care is where it needs to be, and then, like these guys on the road, like being able to respond to calls with crews, to assist them, to supervise them, right? Like to coordinate between like other agencies that might be present on scene, right? So like all of that, yes. So that's true. I think like people don't really realize like how much goes into it from time to time. So
when you say quality outcomes, I mean, what are the metrics that you kind of look at to kind of say we're doing a good job?
Yeah, so we track a bunch of metrics. Some of them are like national metrics, like, when it comes to the operational side of things, like response times is a big one that, like it's national. Then we do specific ones that are part of our state and then national. So, for example, the American Heart Association has an award that is called Mission Lifeline, where they track care provided in the pre-hospital setting by EMTs and paramedics for patients who are having heart attacks and strokes. And so really kind of proud to say that last year we did get the silver award for Mission Lifeline. We're on track to get the gold. Like the gold is kind of like the top one this year.
We're going for the gold. I love
hopefully.
it.
Good. Last year we participate in CARES. So CARES is the cardiac arrest registry to enhance survival. Multiple states in the country participate in it. So basically what we do is we report to them all of the cardiac arrests that we go to pre-hospitally, and then they look at the outcome for that patient, right? So last year we received the CARES Excellence Award for Bristol Health EMS. What we did to receive that award in 2022, our survival to discharge rate for a patient who suffered cardiac arrest in the field was 4%. And then in 2023, it went to 11%, which is actually higher than the national average. So we doubled our survival rate for these patients just by the work that, like our EMTs and paramedics are doing in the field, like kind of like integrating everything, starting with dispatch, bystander CPR, AED use, BLS care at the EMT level, ALS care at the paramedic level, and then obviously Bristol Hospital, like most of those patients get transported there just because of their critical nature.
Yeah.
And then they get from there, they go either in the ICU or, transferred out depending what the need is. But so we monitor a bunch of metrics and outcomes actually.
Somehow I'm kind of dwelling on the, if you have a heart attack, the you said we were at 11%, we were at 4%. So what is the national percentage?
So the national survival to discharge, and remember, they're talking survival
the whole
to
entire
discharge.
thing to when you go home.
Right, so you suffer a cardiac arrest somewhere in your house, like somewhere outside, and then you're discharged home, meaning that you're going back like normal to your normal life. The average is about 9%.
9%
for the country, and like ours last year was 11%. So think about it: if 100 people suffered cardiac arrest, 11 of them were able to be discharged home, and they went back to their previous life. So.
Wow, and when you go in, when you're getting a call, you don't know what you're going to come into, right?
Yeah,
And so I'm just trying to like process in my mind, like what do you say to people about like whether they call or not? Like, what advice would you have? Like, because you get the spouse who says, I'm fine, it's okay, and I just got to sit down and, so.
I really think that, if something feels off, like acute changes, right? So, like an acute onset of like headache, chest pain, abdominal pain, something that doesn't feel right. I think that is really important for people to call 911 as soon as possible. Like you really need to be safe than sorry, right? So it might not be anything, but like getting an ambulance there, they're gonna be able to take vital signs. They're gonna be able to do some simple diagnostic things like an EKG, like a Cincinnati stroke scale, to make sure that like you're not having one of these big things, right, that you need to go to the hospital for. So really important to call 911 whenever there's an acute change, I would say.
So you were talking about stroke. I mean, a lot of times people just think they're having some event and they don't register it, right? I mean,
yes.
And it's sometimes it's the other person in the house or somebody that's there sees some change. But I've always understood it's time to treatment that matters the most. I mean, it's within that first period of time. So thinking about like the totality of all the things that you respond to, what do you see, at the top of your list in today's times?
Well, I mean, it's definitely a mix of different complaints, nature of calls. I mean, you can go the top. I mean, we have a lot of we've been getting a lot of overdoses.
Yeah.
That is, you get that kind of spike and then there's a lull. But we've been seeing a lot of overdoses for the city of Bristol.
Really?
Yeah.
It seemed like going through the pandemic, when I asked the question, it was more, behavioral stuff like, I don't feel good, I'm isolated, and I'm having thoughts about maybe taking my life.
Right.
And before that, it was a lot of substance issues like you just described. But it sounds like what you're saying is we're starting to kind of turn the corner and go back the other way again, which is and there's a lot of programs, available for people to help within our system, of care. So it's really, really important. So how many people work for Bristol EMS? It seems like there's a lot.
There is, yeah. So we're, we're not a huge, agency. I think we have about 75 people.
75, that's a lot of people.
Work for us, including, full-time, part-time, per diem positions. We have the management team, and then we have our dispatch center. So we have 6 dispatchers that dispatch the ambulances, and then we have a combination of EMTs and paramedics. So I think that we're still kind of small enough, right,
Yeah.
to be almost like a family-based environment. But then we do cover a fairly big city, right? So the call volume is definitely there to be able to manage it.
By extension, we cover Plymouth and the town of Burlington.
Burlington,
with staffing.
So we have a lot of vehicles. The vehicles are constantly in for repairs because they run nonstop, right? And they also get hit.
Yes.
But we have 2 new fly cars, right?
Yes.
So how does that work? So somebody calls 911 and needs help. What happens from the point that they put that phone down? How does that work?
So from the point of those fly cars are staffed with a paramedic. They're non-transport vehicles. They're, if you want to look at it, a rapid response vehicle. Depending on the nature of the call, may be cardiac arrest, something that's high acuity. You will get that fly car that goes along with the ambulance. It's an extra pair of hands. It's an extra paramedic on scene to provide the help that patient may require. Typically, one is staffed by a operations supervisor, the other is staffed by a line paramedic.
Got it. And the first responder is The fly car, the person in the fly car, or the police?
So the way it works is, so when someone calls 911, right? So the phone call would go to the Bristol Police and Fire Dispatch that are trained EMD dispatchers to take those type of calls. So based on the questions that the dispatcher is going to ask the caller, they're going to code that emergency depending on the answers that they get. Once they code it, then they would call our dispatch center and tell them what the nature of the call is, where the call is, and then our dispatcher will send an ambulance based on that information that we got from dispatcher. So really important when the public calls 911 to be as specific as possible, try to answer the questions that dispatch is asking them over the phone to the best of their knowledge, because that's how we drive resources. So if a high acuity call comes in, like Boblee said, the police department is going to go there first because they are the designated first responders. They can only provide first aid and CPR. They are at the emergency medical responder level. And then we would either dispatch a BLS ambulance that has 2 EMTs or an ALS ambulance that has 1 EMT, 1 paramedic. And then the fly car would follow if there is that high acuity call to assist them unseen with these patients that need, like more procedures.
I always got confused, but I think you just explained it to me. So you have emergency medical responders. Now, do they have to go through training and certification?
Yeah, that is a certification, yes. So
and then it goes to EMT.
Emergency medical technician, yep.
Technician.
That is also a certification. And then paramedic.
Paramedics.
It's actually a license.
So there's a license for paramedics, right?
Yeah.
So I love, helping people that are thinking about this, because a lot of people think about it. So where do you start? I mean, if you're interested in doing this, I mean, do you start as a emergency medical responder, then go EMT, and then paramedic, or can you go right to paramedic? How's that work?
So you cannot go right to paramedic, right?
Okay.
So you definitely have to, you can skip the emergency medical responder if you wanted to, so you can go directly through the EMT certification, but you do have to be an emergency medical technician in order to become a paramedic.
To be a paramedic.
Yep. So definitely there are many programs in our state that offer EMT certification. So if you're interested, please, look up and see.
Yeah.
But yes, you have to be an EMT for a little while just to get some experience at the BLS level of things, and then you can apply for a paramedic program and then become a paramedic. Like many of the programs in our state are between 1 year to 18 months
for paramedic.
To become a paramedic.
So you're an EMT first for what, like a year?
Yeah, usually that's what it is.
And then
right?
you can go into that program and it's 18 months. Is that part-time? Is that full-time?
So
it depends on the program that you apply to and get accepted to. There's programs that do part-time. They do 2 days a week, couple hours. 8 of the days are evenings, and then there's more accelerated programs. Those are usually your 1 year programs. Your 3 days a week, 8-hour days.
They're full-time.
So.
But you can become a paramedic in 1 year.
Yep.
Well, I think the really thing that's cool about it is that you said that you can go nights, you can go, you can pick, so if you're interested and you're thinking about what your career is going to be,
right,
you can figure out how to make it work within your schedule, right? So and is it expensive to do that?
So the EMT certification is fairly inexpensive. I want to say the average to go through an EMT certification course is about $1,000 or so.
Wow. That's not bad at all.
Yeah, no, it's not. I think that it's definitely worth the investment. The paramedics is a little more expensive. I think that an average rate for a paramedic program is about $10,000 to $12,000.
Wow. But that's still, I mean, you've been doing it, you said, for, I don't know, did you do it before you came to Bristol? You said 13 years?
No, I started in Bristol.
You started in Bristol. Wow.
Yeah.
I like that. That's cool. Yeah. So, but I mean, it's a rewarding, kind of.
100%. For sure.
So, I mean, obviously you come into all kinds of situations. So So what gives you the most, kind of like psychic income, from what you do? Is it, aside from the family kind of environment that you all describe, that you all know each other? So what makes it work for you guys?
I mean, I think for me, I was always kind of like patient care driven, like I really kind of loved medicine in general, just having those, critical, difficult patients where you need to try to diagnose as soon as you can and provide some treatment, as soon as you can. And then just seeing how they would get better, right? From the moment that you got there until the moment that you transfer care to the hospital team, like how thankful they are, right? That you helped them in this really difficult time, right, of their life. That's what really did it for me, right? Like that was what kind of like pushed me to, like get better. That's what pushed me to move from the BLS care to the ALS care, just to kind of be able to do more, right, for the patient.
There's a lot of people in my role that started as EMTs and paramedics, because I know the guy at New Britain who left, and now there's a new person there, but he started as a paramedic, Gary Havikin. So how about you?
Well, I too started my EMS career at Bristol. Before that, came from a completely different background of work, and started off me liking medicine, liking be that helping hand. Started off and just kind of like it's gratifying to see that you can help someone in a time of need, and then being at Bristol, I kind of like how we have it structured. You see the patient from start to finish. We can follow that patient right through till the end, even till they are back home. We meet them in the community. They recognize you, from a mile away. They'll be like, "Hey, I remember you. Thank you so much." And it's just rewarding to be able to help when that help is needed.
Yeah, I live in Bristol, so I'm always running into people, and I hear stories about how amazing you were, picking them up, responding so quickly, making them feel comfortable that whatever's going on, they can feel confident that you're going to take care of it. So we're coming to a close here. So I'm going to ask you, from your vantage point, what advice do you have? What's your key takeaway advice to the viewing audience in terms of how to interact with the EMS? What
I would say is, please call 911. Like if there is an emergency, don't hesitate to call. Like we're always there to help. I think it's important that the public understands that. What I would then say is that if you're thinking about a career in medicine, I think that this is a great start, and like look up some EMT programs, some paramedic programs. We are hiring at Bristol Health EMS, so please check us out.
Good plug, I like that.
like Enis was saying, don't hesitate to call when you need that help, and if whatever we can do to help you, we're always there to help you guys, and we're definitely hiring. Look into the different programs. There's a lot of different opportunities out there to start your career if you would like to start one in EMS.
You're making me want to just go back and not that I don't know any executives that have actually done that recently, but yeah. So thank you for what you do. Thank you for being there for our community. I mean, it's just incredible. I can't imagine a community without a full EMS program like we have. We're very fortunate. So this is Bristol Health Cares, and I am your host, Kurt Barwis. And thank you for being with us today. And if you have ideas or things that you want us to cover, you can write us at cares@bristolhospital.org. Again, that's cares@bristolhospital.org. And we will do our best to try to cover the topic or whatever it is in a future show. I am talking to you from the Nutmeg Studios here in Farmington, Connecticut. This is an amazing community asset, which we all should be very proud of and support. It is a nonprofit organization, and it depends on grants and donations from the public to do what they do. This studio is outstanding. It is a digital studio, full capabilities, and what the team here, the crew, is extraordinary. So Again, from Nutmeg Studios, this is Kurt Barwis, Bristol Health Cares. Until the next time.